Hey, good morning, everybody. This is Brittany Jennings coming to you live from the Seniors Blue Book. And this morning, I have the privilege to be with Melissa and Laura from Secure Aging. Good morning, ladies.
Good morning.
Hi, Brittany. How are you?
Doing great. How are you?
We're doing very well. No complaints here.
Fantastic. You guys even match your logo colors and everything. I don't know if you text each other this morning.
We didn't try
Just
that.
by chance.
We didn't try that. I think that's what happens when you work together for so long. You feel comfortable taking your mask off and you end up wearing the same colors, right?
Exactly. Well, thank you so much for joining us this morning. I'm super excited to dive into a few kind of updates and topics on what you guys do. Let's jump over to Melissa real quick, just for those that are watching, and talk about Secure Aging. Of course, you provide geriatric care management services. Can you tell us a little bit, maybe give us an overview of what those are?
Yeah, sure. I'd love to. So Secure Aging is a financial and care management company. And so simply, we are geriatric care managers. And we get a lot of questions about what that means. And so the industry in the last couple of years has sort of started using the term aging life care specialist instead of geriatric care manager. I like geriatric care manager because I think a lot of people understand what that means. I think what sets us apart from a lot of folks out there is we have a very diverse group of licensed professionals who cover a broad spectrum of potential life-changing issues. So for example, on our team, not only do we have geriatric care managers, and that is actually, that's a certification. So there's an ethical code and there are very high standards that have to be met in order to say that you are an aging life care specialist. So our team is comprised of aging life care specialists. I'm a CPA, so when it comes to financial care management, we've got heavy background in finance. We've got someone who's joined us recently with over 15 years in banking. And then on the health side, we've got, at this point, we now have two RNs working with us with lots of clinical experience between the two of them. And so what a geriatric care manager does is sort of play the role of quarterback or a contractor if you're building a house. So just like you would need someone to coordinate the materials, the labor, the project plans, in this case, a geriatric care manager helps you navigate changes in life. And so that might be a financial change, that might be, downsizing a house, that might be connecting with an attorney. Oftentimes, we're connecting people to community resources. So we're helping with coordinating companion care coming in. It just varies on what the need is for the family. So we're often boots on the ground, and we're helping families with whatever the senior may be overwhelmed with.
Absolutely. I like to, the other one you can add to that repertoire would be an air traffic controller. Like, they're
good.
Like I imagine somebody with like earphones on and they're like navigating all these different things.
I like that. I have to get my signals down, right?
Yes.
Right?
The emergencies are located in the back, the left. No. Anyway, well, that's awesome. Thanks for that overview. And absolutely, that is a differentiator for Secure Aging to have such a wonderful, diverse group of leaders there leading the way.
Yeah.
Laura, let's jump over to you. You've been in the industry now for about 12 years. And I know I'm about in the same boat. It feels like a lifetime of experiences, right?
It does.
Let's talk about some of the experiences, if you can share with us, that you've had with clients before COVID and during COVID as well. Just share some of those experiences you've had with your clients that you provide services for.
Sure. One of the things I think I like about this position is it's never the same day twice. It is always fluid, always moving parts. It's always changing. And a lot of times, we've had clients, many that maybe they lost their spouse. And we've had that during COVID too, very recently, where our clients lost their spouse and maybe the spouse took care of everything. They were living at home and the spouse paid the bills and reconciled the checkbook and did the banking and made a lot of the financial type decisions. And then suddenly that person has passed away. And now the other family members might not be in town, or they might be so busy and need to help figure out, what are we going to do? Now, how are we going to get the bills paid, which maybe have piled up for the last month while that person's been sick, whether it be with COVID or something else. And so now how do we sort through this pile of nails, get everything done, apply for the Social Security. Maybe there's veterans benefits we need to apply for, and then figure out what's the best and safest place for that client, whether they be living at home and setting up appropriate services to keep them in their home, or is it time to, look at other areas for assisted living? Do they need a little more services? And so being on the ground and being able to go in and help assess that and look at all the different factors. And I think for us, having the background we do as with CPA and as finances, we can look at everything and really see what's appropriate placements for them and kind of know what their the big picture. Sometimes it's easy to look at just what their monthly is, and we can look at the long term and really help, recommend to the family and the people what's the best thing. So, and we love the relationship building, getting to know the client and then the extended family. And I think that with COVID, you brought up COVID, during this time, we've been a perfect liaison with the communities, or if the person is at home, with the family members, because they have the access, getting to be able to check on their loved ones in an assisted living, in different environments. Being able as care managers, different times depending on COVID, we've been able to go in and see how the person's doing and give feedback to the families and just be able to be eyes and ears. We had clients in assisted livings that have been now locked down, can't go get their groceries, can't go to just get their errands done. And it's just been so comforting for them to know that, gosh, I can call Secure Aging and they'll help me even if I need snacks and milk for my room.
Laura has taken milkshakes to our clients.
Yes. Milkshake delivery.
Milkshake delivery to memory care.
Yes, and different things to each of the client, whatever.
I'd like to sign up for your services now.
I know. And a whole bunch of cheese crackers and, we pizza deliveries, but it's those special connections. I think that they know, I could tell you specifically which shampoo or which soap, and those are important because there might be little things, but they're important to them, besides just making sure that the bills are paid. And, right now they're all calling us the taxes, they're getting tax statements and documents, and they're all calling saying, hey, Laura, can you come over and get these? And they're, perplexed if they really need to get those to their CPA right away because everything's urgent for them. And so we try to, be there and take care of all those things that maybe an adult child, if they were here, could. And then we can reassure if there are children that we've handled that, we've got their tax information, we're making sure those things are taken care of. So that's a lot of the communicating with family, and the reassuring during COVID has been so important to the family members to know that somebody has eyes and ears and checking on their loved one. I know it would be so important for me. My mom is in a different area, and it's nice to know they're checking and giving them all of those information. And then protecting with scams, don't you think, Melissa?
Oh, yeah.
During
and that's
COVID,
been a big thing.
Yeah, we've seen a lot of COVID-related scams where there's, they're calling, and whether it be for the COVID vaccine that's not real and trying to get somebody to pay to get it.
Trying to come to the house to get the vaccine.
Yeah, there's all kinds of things related to the COVID. And then they've been using their credit cards, and we've seen some credit card fraud because the scam artists
More than usual.
Yeah, they know that people are in lockdown, and so then we review, of course, all of our clients' bank statements and credit card statements, and then we can determine that somebody might not notice, that they think, oh, it's a regular FPL payment or something, and we know that they don't have FPL, they're at a facility, and we can, stop some scams. So that's another important point.
Yeah, it's often about keeping them safe, whether it's regarding their financial situation or their health situation, right? Or just their cognitive, situation. And so your role kind of evolves, and we use this team-based approach with each of the specialists that we have on the team, where, I've seen Laura coordinate with one of our nurses with an adult daughter who is in Africa, working on, because of work. I've seen her coordinating with adult children in Alaska. Mm-hmm. And so it's great to kind of watch the connectivity, because oftentimes as someone's health starts to deteriorate, what starts to happen? The financial situation, everyone gets stressed out about it, right? And so it's helping to calm down. It's a level of calm. It's, we know what to do. We can help you through this.
Yeah.
And I think too, you bring up the services that you provide with your 2 RNs. Can you go into, just for a moment, what are some of those specific services that the nurses are providing for your clients?
Yeah, so nurse care management is not really new to us, but sort of new. So secure aging has been around since 2005, but I would say just about 2 years ago is when we sort of added this deeper layer of nurse care managers in addition to financial or geriatric care managers. And so what a nurse care manager does is assist a family with things like accompanying to doctor's appointments where there might not be someone here to do that, having medical eyes on someone's parents, being able to help interpret a doctor's orders. I've seen our nurse care managers hold family meetings around a particular diagnosis and help to explain what the pros and cons are to having the hip surgery after a parent fell or to not having the hip surgery. You know, oftentimes in end of life situations, our nurse care managers will help families through those decisions. Is it right, or is it time for hospice, or would that not be the right thing to do right now? And they do it in a way where, you know, they're educating and they're providing information, and then they're helping the family to decide if there is a family member who's playing that role of healthcare surrogate. In many cases, our clients have no one. Mm-hmm. So, you know, a really good client for us often is a client who has nobody at all. And many of our clients have outlived their friends and family. And so our nurses will become their healthcare surrogates, and I will often become a power of attorney or help them with trustee work. And then that often leads into estate management, where we're helping to manage through the estate after the loved one's gone. But I've been fascinated watching our nurses, you know, with what they'll do in the home and how they'll educate, they'll do medication management and education. So it's been really fun to kind of watch how the medical and the financial comes together and just helps to provide peace and to helps, you know, help a family. Just a daughter can continue to be a daughter because we're covering some of the most stressful, you know, categories in their parents' life right now.
And it's a nice team approach, being able to work together. I had a very high needs medical client come home from the hospital, from a long hospital stay, and was able to call our nurses to come out for a couple of things because home health services were only limited to 2 days and I needed something done on the weekend. And it prevented them from going to, and if we didn't have RN care managers on staff, probably would have had to go back to the emergency room for something fairly minor, but our RNs can come and assist with the house. So it's just a real benefit and blessing to the clients, and the family were so relieved we didn't have to then initiate another hospital visit.
Yeah, that's a good example.
Yeah, that was just happened this last week. So it's nice to be able to work. It's a great team approach. We really enjoy all being able to have our strengths and work together.
Absolutely. It's a great continuity in all different directions. And I've said this continually, I really do feel like most people that are aging and trying to navigate this complex, let's just call it healthcare journey, they need a care manager. Everybody needs a care manager, because if you need someone to call to ask a question or find something out about A through Z topics, you guys are going to either, if you can't answer it, you're going to find somebody who can.
Right.
So why not? Exactly. Like, why not take that step and get you on board, even if it's early on, just to kind of start that process. But also, I'm sure you get those crisis calls too. So
sure. we take them all. So come, we'll help you out.
Awesome. Well, ladies, thank you so much for joining us today on Seniors Blue Book Live. I'll put all your information for contact, of course, on the video. And I just want to wish you all a wonderful day, and we'll see you soon.
Thank you, Brittany.
Thanks, Brittany.
Take care.
All right.
Bye.
Bye. Thanks, everybody, for watching. Have a great day.